Hello, this is Dr. Gary Bellman. I'd like to share with you today the American Urological Association guidelines on an enlarged prostate. And there are guidelines on various subjects, and I'm going to try to incorporate them into these videos. Also share with you my own take on them. But according to the guidelines, the first-line therapy for enlarged prostate is alpha blockers. Alpha blockers are a group of medicines that were originally designed not for the prostate, but for hypertension, because they do lower blood pressure, but they can alleviate symptoms of an enlarged prostate. There are 5 different alpha blockers that are commonly in practice. Flomax is a common one, Uroxetrol, Cardura, Rapaflo, and Hytrin. These are common, these are the brand names, they have generic names. And they are supposed to be used as first-line therapy. Second-line therapy are the ARIs, alpha reductase inhibitors, that can shrink the prostate, namely Proscar and Avodart. And if these are unsuccessful, then other solutions such as surgical management can be incorporated. What is the problem with these medicines? The main problem is they can all cause sexual side effects. Namely, the alpha blockers and the Proscar and Avodart can cause erectile dysfunction. More commonly, they can cause retrograde ejaculation. The same population of men over 50 with enlarged prostate often have degrees of erectile dysfunction. They can also cause what's called floppy iris syndrome, the alpha blockers. Namely, if someone is going to have cataract surgery, the alpha blockers can cause a potential complication for the eye surgeon. But the main issue is that they can cause sexual side effects. And I see many patients who come to the clinic who are on these medications, and I see the patients who they're not working so well and they're unhappy with the side effects, the sexual side effects. So it's important to be aware of, certainly men who aren't sexually active, who don't care about the sexual side effects or the lack of ejaculation and aren't considering cataract surgery, then certainly these can be appropriate choices. But I just wanted to explain to you the AUA guidelines, the American Urological Association guidelines on what medicines to choose. And the answer is alpha blockers first, adding on the ARIs. Sometimes the daily Cialis can also be helpful. It's important to remember that medicines are not benign. Medicines can have side effects. And these medicines are meant to be long-term, so it's important to remember that. Thank you very much, Dr. Bellman.